Aesthetify India podcast series. Today, we will delve into a very exciting and evolving arena of aesthetic medicine's combination therapies. So, what we will do today in this podcast, we will break it down for you the fundamentals of combination therapies, how it can be implemented in aesthetic practices. And to answer all these questions, we have with us Dr. Syed
Thank
Nazim,
you.
who is a renowned aesthetic practitioner, a dermatologist from Delhi-NCR region, who is not only an expert in this field but also known for his innovative approach towards aesthetics. We're privileged to have you, Dr. Syed.
Thank you very much for
And
having me for this podcast.
Yes. So let's start with the basics, Dr. Syed. We will first define what are combination therapies when it
Okay.
comes to aesthetic practice.
See, we must understand that in aesthetic practice, nothing is standalone. I mean, you cannot just do one particular treatment and get the appropriate results or make your patient satisfied. The reason is, I'll just cite an example. For example, in aesthetics, it is not a disease. It is something a person is coming up for adding on, a dignity to themselves. Like if I'm not wrong, to make someone look youthful and younger, okay? And it gives a lot of confidence people have lost. So it's not a particular disease and there is a one single approach for it. Now I'll cite some examples. For example, a patient is having simple acne. Let's not talk about too much of aesthetics, the more sophisticated part of aesthetics. A girl in her teenage is coming with an acne, and now the acne will leave some scars, it will leave some pigmentation. So you cannot just give, for example, an isotretinoin or oral medications to that particular patient, although that will help her to get rid of those problems. But what about the scar? So you have to add on some new treatment modality or an add-on. For example, you might have to add laser, CO2 fractional laser. Once the acne has subsided, you might have to add some peels. You might have to also add some hormonal therapy if that person is having some hormonal imbalances and things like that. And so that's called the combination. So combinations are very important, and a single standalone treatment in aesthetic practice, it doesn't work all the time.
Perfect. So let me just simplify it a bit. Skin is a very complex structure. We all
Yes.
understand that. And as you rightly said, that not only one treatment will help that particular patient. But what is the role of a patient in all this perspective? Do they appreciate, do they understand that yes, we are coming for a certain issue to the doctor, but do they understand and they want to take those therapies that this will give me a better solution to my existing problem?
See, most importantly, in aesthetic practice, it's a role of a physician or a dermatologist, or for that matter, a plastic surgeon, or whosoever practice aesthetic medicine. Because many a times the patients does not know what is actually their problem. They, for example, a patient comes up and a girl comes up, she might have some freckles, but there's a lot more on the skin. She just sees what her eyes see. So a doctor who is in a capacity to understand, to analyze the face, it's his role or her role to guide the patient. So once you guide them properly, when you simplify the treatment for them, and when you explain them, and then it's very easy for them to understand, and they trust you, and then they go ahead with it. Yeah.
Okay, so counseling plays a very
Counseling plays a very important role. Guiding patient plays a very important role, because I must tell you, for example, I can give you a lot many examples. For example, a patient with diabetic, they know there's an option of medications or insulin or things like that. Most of the people know, but then they go to the doctor, and doctor in his capacity see what is the blood sugar level, what is its HbA1c, and accordingly the doctor prescribes the medicine. But when they come for the aesthetic issue, somebody has sagging of skin, she doesn't know what sagging is. She will say, oh, I look sad, I feel there's a fat around my jawline, I feel not so confident. You got me? But they don't know there's an option of thread lift, they don't know there's an option of fillers, they don't know there's an option of facelift, they don't know there's an option of many other things, the lasers and skin tightening device. So a doctor has to analyze. I must tell you, only that physicians in aesthetics are really good who are able to analyze patient's face One. The second is then guide them accordingly. And I will cite one more example, which I always tell to my patients that they ask, doctor, I just want to get rid of these forehead lines. Or I say, listen, let me analyze your face. And I don't want to get Botox, I don't want to get filler. I said, it is just an art. The aesthetics is an art and science. I don't call it a science and art. I call it art and science, because it's just like you need to paint a painting and you need to have different colors. You just imagine that different colors are different treatment modalities, a combination therapy, what this topic is about. So you need to have, for example, a filler, a Botox, a thread, a laser, the skin tightening device. Then and only then you can give that wow results what patient is looking for. So counseling a patient is important, guiding a patient is important, and let them take their time. They may not opt to go for it immediately, but they'll come back and they understand, they will comprehend this, and they'll come back to you and they will definitely get it done.
Absolutely. So a patient is a canvas for the dermatologist,
Exactly.
for which you need arms and emanations, which includes science definitely
Absolutely.
and your aesthetic sense as a
True,
practitioner.
true.
So again, I'm going back to the patient journey. I want to understand here that do these combination therapies lead to more long-term and sustainable results for the patients?
Yes, absolutely right. For example, a lady is coming up with a sagging of face, and she has got the jowls, she has got the nasolabial folds, and for that matter, there is a flattening, there's a volume loss over the cheek. So simply somebody can say, "Oh, let me go for a thread lift." I'm talking about non-invasive treatment option, not the facelifts and all. So, for example, let me go for a thread lift, but you have to counsel that patient, like you have to equally add some fillers there also the thread. Maybe later on you might have to add high food treatment options to get that wow results. So yes, these things happen, and as I said again, the guiding a patient in that manner, and it is quite acceptable.
Okay. So we've understood the patient side that if a right counseling is done, then definitely they will they are coming with a trust. So once you guide them, counsel them, they will go for combination therapies. Okay. So now we will go to into specific therapies which are getting popular these days. So let's start with the combination of boosters and fillers.
Correct.
So I want to understand whether you prefer it. If yes, why? If no, then also why?
I do prefer boosters, and because see, when something comes into market, we have a responsibility as a doctors that we do proper R&D. And skin boosters do have a role. There are proper appropriate studies for skin boosters. Skin boosters, see a patient who comes for a filler and a booster. The filler is to give volume to that specific area of the face, and the booster will again boost the dermis of that particular skin of that particular area. Like it will activate the fibroblasts to secrete more of glycosaminoglycans. It will activate the fibroblasts to have more of a collagen, more of a fibrin. So that will make your skin be more youthful and better. So that gives a condition we call neocollagenization. So neocollagenization, the primary part of the boosters is to trigger that neocollagenization, which makes skin more youthful, which triggers that mechanism and cascade of events that actually lead to a youthful skin. Yeah, and then coming to fillers, yes, on top of that, you do the fillers. So a combination of fillers and boosters, it's good, but not in every case. Again, a young girl for in less than 30 years of age, for example, just wants to get a little bit of short and get a high cheek. You just need just simply a filler. You may not require booster, but a person above 40 years of age, we do recommend boosters.
Okay.
Yeah.
Yeah, that makes a lot of sense. Now, energy devices, you have talked about it when we opened this podcast, but that what is the role of energy devices when you club it with non-invasive treatments?
See, energy-based devices, as I said, it is the amalgamation of all those techniques and treatments that can give us appropriate good results where you can make your patient satisfyingly go home. Now, when we talk about energy-based devices, we have a lot of options. Like we have HIFU, we have radio frequencies, we have CO2 lasers. There are a lot of other treatment options nowadays which are available, which work on skin lifting procedures or also skin tightening, their mechanism. So combining energy-based devices with other treatment options, it's very good. But again, I say not applicable on every face. It is subjected to patient. And the big challenge in our Indian market is that it procures a cost. So you have to equally see whether your patient is able to afford it. Then you have to prioritize. Now, combination IC is always good, but then prioritizing the treatment is again a big factor. I must tell you that a patient with a limited budget, gone are the days we were targeting people who were, having a deep pockets. Now, even a common girl you will see will have branded clothings, or for that matter, because they want to do that. It's so likewise they want to look youthful, they want to contour their faces, and that's fine. And the prioritizing the treatment is something which is again something should be done by a doctor. For example, you have to look into the budget of your patient. Now patient requests, for example, an energy based devices or a filler. Now it's a domain of a doctor which treatment is cost effective for that particular patient, so that it can give her a good results, and she spends less.
I think that's a very important point that you have raised, that you as a doctor need to prioritize. We cannot offer all the
Absolutely.
treatments to the
Absolutely.
patients.
Absolutely.
Yes. And as more and more patients are becoming aspirational, we have a bigger set
True.
of patients who are walking into the clinic.
Agree.
I completely agree with you on that. So also I want to highlight, there is a new concept of biorevitalization in the market, and there is a shift also that doctors are focusing on treatments which are boosting skin's capacity to heal and regenerate on its own. So I want your point of view on that treatment line also.
See, again, as I said, this particular treatment you talk about is again based on boosting and triggering the neocollagenization of the skin.
Okay.
And it is not applicable on every skin. For example, I give you an example. A boy in his teenage, if he breaks the bone, he can easily be fixed with a cast. But somebody 40, 50 years of age, he might have to go for a hip replacement therapy or for the more specific surgery, because at that stage and age, the body doesn't have a capacity to regenerate. Now, when you talk about these bio revitalizers and all, they are more good for specific age group, not for the younger generation. So the people who are less than 30 years of age, you may not require those things. Okay. But yes, for elderly above 50 and all, because there you need the skin should boost. It's not just filling the skin with the filler and giving the contouring. It is just the skin should be boosted to trigger the mechanism where it will sustain, those results will sustain for a longer time, and it will again lead to youthful skin by triggering the natural mechanism of the skin.
Right. So we have talked about acne situation also. So do you think these biorevitalizers can help a patient who's young but has acne situation? So there a regeneration or a skin capacity to heal on its own will be helpful?
See, a patient who comes with an acne, there's a big issue that in our Indian scenario, a lot of patients, their parents tell them it's because of the age, it will go, but they don't know the consequences of acne will be the scars, there will be the pH pigmentation, and when they grow and they reach to the age when they want to have their boyfriend, girlfriend, or want to get married, or they reach to the age where they get that maturity, where they get guarded when their skin is not looking good. So, but then they repent that, oh, if I would have been treated appropriately at that stage and age when I was a teenage, so this cancer should have not happened. Now, in that context, there is the acne and revitalizers and all. See, acne itself is a disease. It's a problem which needs to be sorted out proper, giving a medical treatment. So it always starts with medication, taking patient's history, and lot many other things. Okay. And there are a lot of treatment options. Now, biorevitalizers have a role if patient has an established scars, depressed scar. There it can trigger again the same mechanism that can help us to heal those scars. Otherwise, in actual acne, you don't have any role of biorevitalizers, where you need to settle down the sebaceous gland down there. You need to get rid of that all the you need to halt that physiology of the acne. And but yeah, once the acne is established and now patient doesn't have acne, now patient is even less than 30 years of age, because it happens more in young people, but has an established scars, yes, there's a role of
Okay.
biorevitalizers.
Yeah, that's very insightful, Dr. Syed. So now we've talked about specific treatments, specific combination. Is there anything else you would like to highlight here in this podcast, that there is something else, any other combination therapy which is working well, especially in your own practice, and that will be helpful for them to understand new trends in the aesthetics?
See, now there are a lot of new things coming up, but they are still in testing stage. We don't have well established data on it. Like exosomes, there are a lot of exosomes coming up nowadays. They have specific activity and they help us in giving a more youthful, I mean, clean skin, and I mean, anti-aging qualities and all. There are, these things are trending nowadays. But again, with a caution, I must tell, the you have to understand the source of that particular product, because in our country a lot of things are not yet regulated properly, although these products are imported most of the times, and I mean they can skip any customs and just get into the market, and it's not coming under the scanner of the government and all. But it's the duty of a doctor to understand what are the current evidences on that particular treatment, and accordingly that can be implemented in their practice. And likewise, if I talk about new trends right now, there are different combinations of threads coming up. With previously we had PDO threads, we have PLLA threads along with hyaluronic acid, and different companies are coming up. You have equally not only this hyaluronic acid, the fillers, you will have also the PLLA fillers coming up, which are more, I could say, permanent fillers and all. So different things are coming in market, but yes, I must say that until and unless you have a good pool of patients in India and see what have been the results, it should be practiced with caution, and you should have, until and unless you have a good evidence on those new products, it should not go randomly. That's otherwise most of the things are quite safe.
Right. So, right source is very important for
Absolutely,
you as a
absolutely,
doctor when
absolutely.
you're procuring the products. Okay. So, sir, would you like to share some published articles and research papers for our audience here who want to know more about these combination therapies and update themselves with the global trends?
See, there are a lot many publications on PubMed which talk about these combination treatments. I think there are more than hundreds of such publications, but specific to the aesthetic field, where we couple of publications. One is in the Dermatology Surgery 2020 that talks about by Cartier's NH, and that talks about the combination of different injectables like HA, the toxins, the threads, and all. One is in the aesthetic plastic surgery, the 2020 again, which talks about the energy-based devices and the injectables.
Okay.
So these two studies, there's a good matter in it, and where you can get a lot of knowledge how to these aesthetic treatments work, and what combinations are appropriate, and when and how to use those combinations. And there's a lot of new science coming up, and everything new. I mean, a lot of things are evolved now. A lot of new treatment options are coming up, and the techniques have changed for that matter. For example, I must tell you a small point. Back 10 12 years, when we used to start with the fillers, we were injecting very easily fillers in the nasolabial fold. Now it is a no, because you could have a complications here, and now you prefer to inject more lateral to give more lift, unfold those fillers rather than injecting into the nasolabial fold. So the techniques have changed from last 10 years. The products have become more better in that quality of the products, and the products, for example, if I talk about the fillers for different areas, they have changed. For example, there's a specific product for the cheeks, specific for the chin, perioral area, under eye. So you have a more wide range of products available. Different brands have come up to India. So, but as I said rightly, you have to not only don't go for the cheaper things. Always look for an appropriate product which has got a proper science behind it, and a proper distribution channels and all.
Right. I think it has been a very insightful talk. One last tip, probably. We've talked about new injectors also, but there are lot of dermatologists who have not, entered the aesthetics so far, they are still restricted to clinical dermatology.
Mhm.
So one tip on this topic for you, so that we wrap up today's
I
talk.
think they should they should ASAP get trained and join the aesthetics. It's the future because people really want to look youthful, better. They want to live a quality life. Gone are the days like people used to visit dermatologists for simple, for example, dermatological conditions. That is true that we must stick to our core dermatology, which is very, very important. You should not forget your core dermatology. However, you should try and come into the aesthetic field, learn it properly. So you get trained on particular treatments, particular aesthetic treatments, one or two or three, and then combine it with your clinical dermatology. That will really help you in growing in aesthetic field and continuing your clinical dermatology part.
I
Thank you.
think that's a great tip. Thank you so much,
My
Dr.
pleasure.
Sir.
My pleasure.
We couldn't have found a better suitor for today's
No,
talk.
thank you. It was a pleasure having you guys
Thank you so
on this
much.
podcast.
So, before we wrap up, I would say that we have set a perspective today, a perspective where we are saying that a patient is not restricted to one particular treatment. It's a journey which is not restricted to a filler or a toxin or a booster. Rather, it's a combination of all the treatments which is making them a better versions or a more confident versions of themselves. So thank you so much. Please like, share, and subscribe our channel for such more insightful talks from experts in the industry.